We took individuals that were coming in for regular eye exams. They had to be 25 years and older, and an iWellness scan was run through the iScan OCT by Optovue. And essentially, the nice part about it was the technician, really all they had to do was line up the patient, because the instrument's actually taking the measurements automatically for both the right eye and the left eye. The patient was then examined by myself, and then after the examination, the iWellness scan was examined to determine whether or not there were any abnormalities that showed up on the examination or on the iWellness scan. So the results from the study were pretty interesting. Essentially what we found was, globally, amongst the 109 patients that were actually enrolled in the study, there was about 32% of them that actually showed up with abnormalities. Now what was really interesting about the study is when we started dissecting age categories. So for example, we looked at individuals, again, people just coming in for their regular eye exams, or what we typically consider routine eye exams, between the ages of 25 and 49 years of age. We found that there was about 12% of those individuals that actually came up with some type of abnormality on the iWellness scan. When we then segmented the population from that first group to those that were 50 years of age and older, we actually found that 50% of those individuals had something that was scanning abnormal on the iWellness scan. Ganglion cell complex was one of those metrics that actually was most frequently encountered to be abnormal. Ganglion cell complex is literally a direct metric of the thickness of the nerve fiber layer, the ganglion cell bodies, and the dendrites of the ganglion cells. So you're looking at this complex, and that's directly related to the nerve fiber layer thickness. What this gives us an indication of is whether or not that individual has a normal versus abnormal thickness. And when it's abnormal, it starts leading us down a pathway of further investigation to determine whether or not the decreased thickness is just a normal thinning for that patient, or if in fact it may be early glaucomatous changes. So when an abnormality in ganglion cell complex, or GCC, is determined, what we then do is we have to monitor and follow these patients to, again, determine whether or not the abnormality that we're seeing is a normal thinning for that individual, or if in fact it is secondary to some type of condition. Typically, we're looking to rule out glaucoma in these individuals.